Welcome to the Elite FTS Table Talk Podcast with your host, Dave Tate.
Hello, everybody. We are back again with Table Talk. This week has been a hectic week because we have the Sport Training Summit coming up. So I want to give a special shout out to Sydney and Janice for helping me with some of the research that we're going to be doing with the podcast here. The guests that I'm speaking to, I really don't need a lot of research on, but I do like to see what's going on and what they're currently doing to be able to make things a little bit more relevant to what's going on. And they saved me a lot of time by stalking your social media and other things like that to see what you've been up to. So I want to give a shout out to them and a shout out to the people who have been listening, and to thank Ken, for sitting down to have this conversation. What direction this goes, well, we'll just see. We do have, questions from the research that they pulled, which I wouldn't really say is, reading people's comments on Instagram, and reading people's posts on Instagram would be considered research. Let me repeat that. Social media, reading is not research. A lot of people today seem to think that constitutes research. I just did 2 hours of research on the Max Seffer method. Really, what'd you do? Well, I was on Facebook reading, yeah. Let's get, I'll get Eric out here and we'll talk about research sometime, because that's ridiculous. And so from that standpoint, let's go with, because your bios are kind of different on each site, so I don't want to say how would you define yourself. I'm trying to avoid asking you any question that I've been asked like a million times before, just because it's the same repetitious crap. So you fill multiple roles in your life. So what are those roles that you fill?
My main focus has been always clinical. My profession is chiropractic. Been practicing since 91, so it's 28 years now. And also education of myself as far as me presenting, and also trying to put together the best in the world to collectively, educate people at a higher level. And then the interesting thing is the interactions between the top people in multiple fields. So usually what you would see if I went to a chiropractic seminar, all we do is talk about chiropractic. But at the Swiss Symposium that we'll get into a little bit later, I would have 4 or 5 streams. So I'd have a training stream with all the top bodybuilders, powerlifters, strength coaches, a rehab stream of all the top people that do that, nutrition stream, treatment, which was always very, very interesting. And then I did another one in 2018, which was the underground, which was just weird shit that, was kind of out there, and why does it work, and how does it work?
That was one that kind of came out through I believe one of the Instagram questions it could possibly be, but I'm just going to jump right off on that. What are some of the most interesting modalities that you've seen that when you first see it, you're like, what the hell? And then it actually worked. It actually had something beyond just placebo type effect.
What we're starting to see, and it's happened in the past 5-10 years, 2 different areas. One is energy medicine. So the input of different types of energy, whether it be microstimulation of different hertz and different components of that, laser energy, which is another way that you can do that. We're starting to see light energy through the eyes, so you can stimulate that. And we're starting to see how do you recover, especially the brain. So one of the things that I've seen over the years of treating a lot of the powerlifters and bodybuilders is that they would always have a chronic injury, and it might be local. So say they strained their, pec, and usually that's a 2 or 3 week thing that it would turn around. But then it stays around, and it's like, all of a sudden the entire arm doesn't work as well and they're benching off. So then now it turns into a regional problem. So it's not just the muscle, it's the joint, and maybe even the upper back. In the past 5 years, 10 years, we're starting to see that we're also dealing with a central problem. And one of the clinics that I worked in was a chronic pain clinic. And what they found is that if you've been in pain for longer than 6 months, the actual structure of the brain changes. So the prefrontal cortex, all of a sudden you become sensitized to pain, and now you can't recover from that because the shoulder healed a hell of a long time ago, and you may not even be dysfunctional, but all of a sudden the brain changes, and we're seeing this with concussions. That's starting to be huge. And you can get a concussion easily, like in a car accident as a classic one, or if you slipped and fell and bashed your head and get a headache for a week or two, but that can create a deficit. So now we're starting to see, how do you treat the brain? And there's starting to be more and more modalities, whether you use different lights in the eyes, you can use different sounds to actually change the brain. You can, Dr. Fred Carrick has used caloric, because a lot of times people have walking problems and the cerebellum is basically not functioning as well. So they'll do certain types of tests to determine where the deficit is, and they'll use warm water in the ear to stimulate that, and all of a sudden it changes. The other one we're starting to see, and I brought some stuff out here to show some of the research, is actually stimulating the ear itself. And I took a year-long course. It's called auricular, which is the ear. And when you stimulate the ear, it changes the brain. And I'm like, how the hell does that work? Well, there's a few cranial nerves that actually innervate the ear. So it bypasses the spine altogether, and it goes directly into the brain. So we're starting to see huge changes just by doing that. You can drop cortisol, you can change cardiovascular aspects, the vagus. Just 2 months ago, they just approved in Canada, it's actually from the United States, it's called the PONS. What it is that it's a plate that goes onto your tongue and stimulates it. Kind of feels like champagne bubbles on your tongue. The tongue is basically innervated by a number of different cranial nerves that go back into the cerebellum. And all of a sudden, people that had walking problems, Parkinson's, movement disorders, they go away. And you're like, holy shit. So if you change the brain, and it's only done by stimulus, and the gym is a stimulus, huge. But if you also have some of the sensations, change it. We're starting to get more and more educated. How does it work? Why does it work? And the side effects are basically minimized, because it's not as if you're using a drug for that. Like the worst side effect for a lot of the stuff is it just doesn't work.
Do you see any, because you said it was the energy, basically,
Mm-hmm.
and when I hear things like that, I'm asking myself, which system are we speaking about here? Are we speaking about the lymphatic system? Are we speaking about the circulatory system? Are we speaking about the nervous system? Are we speaking about some kind of intervention? Or all of them kind of tied together? Everything works together as a unit.
They do.
But one of the big trends, I guess you would say, it's a terrible word to explain what I'm trying to say, is people like to jump down one road today.
Mm-hmm.
If you're reading, it's like, okay, the lymphatic system does this, and this, and then
Right.
they forget that that's still connected to, the knee bone's connected to the thigh bone. Where do you see most of this rooted in? I mean, the brain is obviously going to be central nervous system.
Huge.
It comes just a little bit closer to
Yeah.
So I think one of the biggest things is that you need a proper assessment. And that's been the challenge in my own profession as a chiropractor, is that, we would think that the only thing that needs to be done is you just need an adjustment, which works until it doesn't. And I found, and I think that's the thing that I've done with Swiss, is that I brought everyone in. And over the past 20 years of me doing this, I have found that everything works until it doesn't. And so you need a multimodal approach. You need to do a number of things. You need to work on the muscle system. You need to work on the lymphatic system. You need to work on the reflexes. You need to work on the nervous system. All of those different things. And the more things that you do all at the same time, the more powerful it becomes. But if you have a system and that's the only thing you do, and you see this with the active release technique. I was one of the assistant instructors for a number of years. Great technique. But if the joint isn't moving correctly, the solution is not do more fascial work on that. And we find the same thing even with the chiropractic. You can keep adjusting it, but if you have adhesions in the muscle, it doesn't work. So you need to do the right thing at the right time. And part of that is doing proper assessments, trying to determine it.
Going back to you speaking about the brain and pain and being desensitized and so forth, there's so many different avenues I can go down here. Just using myself as an example, pain or shoulder, lack of mobility, frozen shoulder, whatever you want to call it. I don't know if it's even called frozen shoulder, if it's bone spurs and arthritis, but you get it. So I've been on pain management since 2005, and it's controlled, it's prescribed, guys, so come on. And my doctor's a dickhead and makes me go off for, and this becomes relevant though, because he does make me go off for 8 to 12 weeks a year, and I don't have withdrawals because the dose isn't really high enough, and the med I'm on is obviously not that addictive to me, but the case could be made, well, you started in 2004, it's 2019, so I get that. But anyhow, what I found, and what I didn't realize at the time until after speaking with my doctor about it, is when I would go off, it was fine. I mean, everything was cool. It was not a big deal, like maybe a caffeine withdrawal for like a day. But holy fuck, the smallest things that would hurt, like bashing your thumb in a door slightly, felt like somebody slammed it into the door. And I remember calling him, like, what the fuck is going on? Like, this should not hurt. Like, these things that are in my body right now that I'm feeling that I've never had pain in before are like debilitating. I can't move. And he's like, well, you've been desensitized because of, the narcotic in your brain, desensitized. This is why you're actually going off for the 12 weeks, is to get that sensitivity, to get it back. And then it takes between 8 to 10 weeks before it's like, okay, cool, this is good. And then the only thing that hurts are the things that I'm actually taking the meds for. But it was amazing to me that it pissed me off. It's like, my mind can't be this weak. Like, how? But it's like you have no control over that. No. It's just like, what the hell? My hands shouldn't hurt like this. It's just crazy. And then the other thing that you were speaking about that I've seen with myself, with my pec, which is a long journey discussion there, but I'm going to use a different example because it's more recent. Some of the lifters that I've seen is they get an injury, which top level lifters, I still believe it's not a matter of, getting hurt or not getting hurt. You're going to get hurt.
Yes.
And anybody who's telling you that you're never going to get hurt, they're probably lying. And they've all had injuries themselves. It's just how people start to define injuries a little bit differently the deeper that they get into the field. So when they're a competitor and they're going to a meet, they're going to be bitching about how they pulled their hamstring a little bit a couple of weeks out. All right. Then when they're, 10 years in the field, all of a sudden I've never had a hamstring problem in my life, and in some aspects it's true. They still did the meet that, they did very well at the meet. They dealt with it. They rehabbed it and so forth. And it's just, the lines get blurred a little bit sometimes where, I could also go back and say, I've never really had a muscle problem outside of my pec my whole entire career. But then we can start digging down and there's tons of little pulls and tears. But what I find is when one thing happens, and say it's a minor thing outside of like bicepial tendonitis, which is usually, I find, from holding the squat bar too close. If it's outside of something that's just such a norm, pec strain, knee I don't even know how to tendonitis. And it's so hard to sit there and say, I can't diagnose anyhow because I'm not a doctor, but I can kind of get pretty close and say, look, this is muscle, this is tendon, this is, either way, you still need to go see somebody. Or like IT band, like a little strain in there. Something that's enough to be able to set them back a couple weeks, and then they're able to high rep train through it, train around it, and then get back in it, and then their lower back starts to hurt. All right, and then from there, the subscap. Yeah. From there, their neck's all jacked up. And then they decide to go see the chiropractor. And they, at this point, have completely forgot about the IT issue. And it's kind of like, I've always equated it to like a turd in a toilet. Like you flush the toilet and you want the turd to flush down, right? But sometimes it doesn't. It's just the floater. It just keeps going.
Yeah.
So you try to flush again, and maybe it goes down, maybe it doesn't. But a lot of the times your toilet's clogged and you don't know it. The IT band, the back, all this misfiring junk or whatever is going on. And the next thing you know, you got shit all over your floor. So now you have to stop and clean the shit off the floor.
Yeah.
But before it was just a matter of standing up and flushing the toilet. So that's what I see so frequently. Yes. And the difficult thing is, or the question that the listeners would have is, if I don't have a practitioner or somebody I can go to, where do I go for help? And before you answer, I'm going to preface this and say that you understand and I understand that with most practitioners, their modality will always be the cure. And that's their only, because they only have one modality.
Right.
So my answer would be find somebody who has multiple modalities.
Yes.
But before you do that, I think they should look up, people like yourself, read some of your content, some of the stuff out there to get an idea of what the global effect is. What would you add to that?
I think the biggest thing is to have someone that looks at you from a complete standpoint as opposed to just a shoulder injury. And I'll give you a case in point. I was at the World Championships, juniors and masters and women. They held it in Hamilton, just outside of Toronto, back in the 90s. So they had a Russian lifter, and he was in the 165s, and he was going for a world record, junior world record. I think it was about 425. And he missed his first attempt, and so he came back with the coach, and they said, "Can you work on him?" And the right arm was he couldn't lock it out properly. So I did some work, and I worked on his shoulder and everything, and then he went for his second attempt, and he also missed that. But what I did notice is that he walked with a limp, and I went, "What happened?" He says, 3-4 weeks ago I sprained my right ankle. I went, "All right." I said, "So when you're benching and you're pressing hard, is it painful?" He says, "Oh yeah, it's really painful." I said, "Okay." So I basically, the shoulder had healed, and I just went down to the ankle. I did a ton of work down there, muscle work, adjusted the ankle, everything else, and he said, "Oh, that feels a lot better." Basically, it was just jammed up from the sprain. And I said, "So try pressing down. Is it painful?" He says, "No." He says, "Okay." So he went out and he actually set the world record, because all of a sudden, and it wasn't, he had a little bit of deficit, but nowhere near. So you need to have someone that will look at you from a complete aspect, not just, look at the shoulder.
Yeah.
So when people come in to see me, I don't care what you have. I'm going to have you just walk down the hallway. Have you walk down, and so all of a sudden I want to see how you move in motion. Or when I had my other clinic, I would put you on a squat. It says it bothers me when I squat. Okay, let's see how you squat. And a lot of the problems won't show up until it's heavier.
Yeah.
And that's the biggest thing, is that all of a sudden all the deficits start to show up. The arm starts to lag. You start to torque. Your body changes as you're doing the deadlifts. From that, now you can actually go, okay, where is it actually breaking down? Because that's the major issue. It may have nothing to do with the injury, but it's a contributing aspect of it, and that's what the reoccurrence is. So I think someone that, as far as finding someone, Number one, that is definitely multimodal. And I don't care if it's a physical therapist, a chiropractor. Most medical doctors, some of them are getting into manual medicine. Most of them, their modality is usually drugs. And the other aspect that's coming around is the PRP and the stem cell, which is fantastic. It can really, really make a big difference in certain situations.
Do you think that might pull the medical field and the holistic field together a little bit more?
Yeah. I'm starting to see that more and more, where we're starting to collectively work together, and that works out the best, where you have someone that does manual medicine, your hands are on them, you're actually working the tissues and everything else, and then you have someone overseeing. So imaging can kind of give you an idea as far as the ultrasound, the x-ray, the MRI, and that gives you an idea, how bad is it? Now, the other flip side is that you may have a disc herniation, but it's not even contributing to it.
Yeah.
Because I mean, you had it for 10 years.
Yes, it could have fused itself.
Yeah, it's already healed.
Yeah.
It's already healed. So, and actually it was interesting at Swiss 2016, Donnie Thompson, he was showing up, he put all these different x-rays of these pre and post, and the disc herniation was gone. Like, I mean, he pulled this out of some of the orthopedic surgeons that he was working with, and he went, oh shit, I didn't know that, that could happen. And Donnie's like, yeah, it can heal. It's a tissue. It can heal. So I think the biggest thing is that we underestimate how well the body can heal itself, especially if you go from that, and also give it time to recover.
Yeah.
We've chatted about this, and it's like, I think that's the biggest thing that I've seen, especially as you get older. And I've seen, so I've been competing in powerlifting for about 40 years now, and I've just seen a huge shift over the years of people just not being patient. They don't want to put the 2 to 5 to 10 years in. Like, they want to set records in a year. In bodybuilding, I want to become an IFBB pro in a year. So they just take a ton of, drugs and training and everything else. It's like, it takes time, and that's the challenge that most people have, is they keep pushing it, and they don't realize that you actually heal and actually get stronger when you rest.
Yeah, and I don't know if that's really a new generational thing. To recap to some of the listeners before we got on the podcast, Ken and I were speaking about, Stu McGill. One of the things that he has a lot, I never want to say all because I don't know, a lot of his patients, clients do is to not weight train for X period of time.
Yes.
And he'll determine that based upon the injury and the analysis and everything else that goes in there. And what I found interesting with that, and by no means am I anywhere close to being on the same spectrum as Dr. McGill. It's like I'm under the table and he's like on the ceiling. But the one thing that I found with the lifters that I work with is, and I've written about this and had other podcasts, or not podcasts, but table talks about this, is after a meet, I have a rule that they cannot put a barbell on their back or any load on their spine or in their hands, barbell wise, for between 4 to 8 weeks. So no yoke bar, no spider bar, no power bar, hack squats are even questionable. Standing calf raises are even, I want no spinal loading whatsoever, because they just went through 3 or 4 huge blocks, of heavy spinal loading. A gear or not, gear is actually worse because it doesn't support you at the top. So you're actually holding more than what the spine would hold if it was raw. And then on the bench press, I think people forget about this. That bar is compressing down onto the cervical spine, and you're actually pulling your shoulder blades together and down to actually create more pressure and muscle tension to take it. I mean, there is a balance here. So don't get me wrong. It's, if you keep the muscles tight, it's going to lessen how much stress is going to be on the spine, but it's still there. And over a period of time, it's still there. And then you compound that with the excitement and the energy and the blast that a meet brings. I'm now hesitant to use the word central nervous system as often as I used to, because we know so little about it. It just seems to be like the go-to. All I know is if somebody does the meet, they're fucking exhausted, afterwards, just mentally, they're just shot.
Yeah.
And What I found is the more advanced the lifter, the more time they need.
Yes.
And they do get weak. And when I was at Westside, Lou, we always had a rule. His rule was we had no off season, but the reality was we kind of did. You know, there were time periods of the year where you just did not let yourself get any weaker than 90%. Well, that's hard. That's very hard. To me, that's really no off season. I mean, that's hard. When I have my advanced lifters do this, they're going to fall down at 80%, you know, if it's max effort work. So I just make sure they do max effort work they've never done before. You know, I keep it away from any kind of negative mental issues that they could have with that. The beginners, I'm experimenting now, but I'm not going to have do as long, because then I can get them back and work more on the technical aspects and so forth. And since doing this, I've had 0 injuries associated with the spine. All right. I'm not going to say 0 injuries, because there's still elbow tendonitis as far as bench press, especially people who use gear and shirts. It's just overload. Some of these things are hard to find and navigate, especially lifters are notorious for waiting until they're symptomatic, or actually waiting until they're too symptomatic. You know, they wait till they're fucked up.
Yep.
And it's almost at that point, it's like, we just got to get through the meet, and then you need time off. So either way, it still falls back, you know, till you need the time off. But I found it interesting, and I also see that the exact same thing happens with the majority of the lifters I speak to. They might take a week off. If they think about, you know, chiropractic or any type of therapy, they're not going to do it then. You know, they're going to wait until before the next meet, which will be another conversation about that. But expand on what I'm talking about with the spinal loading.
Well, I think the big thing, and Dr. McGill at Swiss 2018, what he talked about is that when you do axial loading, so when the bar is on your spine, squat, and even with the deadlift, because you're still holding on to it, what he found is that the spine itself, the vertebrae, go through microfractures. And it's called Wolff's Law. And what that is that the body will always adapt to whatever stress that you have. So we see this in the martial arts, where they'll just hammer against something, and it'll go from what is known as a spongy bone. And if you take a look at a vertebrae, the vertebrae themselves, it's not all bone. Like it looks like porous. It looks like a sponge. And over time, that spongy actually starts to break down and lay down more calcium. And he said that is actually what you want, all these little microfractures. But the key here, and he was really emphatic about it, is that you need time for it to recover. So it's not the central nervous system recovering, it's not the muscle recovering, it's the actual friggin' bone. And so he says where we get into trouble is that the bone doesn't have time to heal, lay down the new bone from the microfractures, and now you turn it into a macrofracture. And what he did is, this was 20 years ago, so one of the lifters that he was working with, he was deadlifting about 650, he was in the 181s, and they did what is known as video fluoroscopy, and they would actually use an x-ray unit and watch his spine, what would happen, and how it would deform and everything else. Well, Stu has the only injury ever caught on film, because what had happened is he had his vertebrae had actually collapsed. He went through end plate fracture and basically a compression fracture of his vertebrae, which that ended his powerlifting career. But that's what can actually happen, and that's where we get into trouble, not from the nervous system, not from the muscle, but from the actual spine itself. The disc, it can break down also, and it needs time to recover. But we're starting to see more and more bone injuries. And we've seen it in powerlifting, where all of a sudden, if someone, especially the younger lifters, if they don't have enough time to lay down that bone properly, I've seen bones actually snap.
Yeah, I've seen forearms. I've seen
forearms,
spiral fractures of the quads.
Yeah, well, or of the tibia. That happened actually in Australia. This was back, I think, in the 70s. Guy was squatting a junior lifter with 700, and all of a sudden his entire lower leg snapped in half. And it's like, what the hell?
Yeah.
You get through the stress fractures, and the stress fractures all of a sudden go into a compound fracture. So again, it's just a time thing. It's not a supplement. It's not a special treatment or anything else. They can help, but it's just time.
It's adaptation.
Adaptation.
What I'm hearing is, the bones basically, if I'm understanding correctly, go through the same process as what muscles do. You train a muscle, you tear it down, it recovers. It needs time for the supercompensation to occur, which everybody forgets that step. It's like train, recover, next, that the supercompensation needs time to recover. And we all know that muscles heal fastest. And then I believe it's bone might be second fastest. I think it's tendon. Ligaments are slowest, I believe, as far as healing.
Ligament, primarily due to the lack of blood supply. To get 100% healing, the research has shown, of a ligament, due to the lack of blood, takes 9 months.
Yeah.
So if you sprain your ankle,
you're fucked.
Well, no, you'll feel good in a month.
Yeah.
But I mean, it's still healing. And so technically it can take up to 9 months before it's fully, strong and viable and everything else. So
where's and I know there's still specificity as far as individuality here, but bone and tendon, where's that? Because I can't remember.
I think bone would take longer than tendon.
Yeah, that's what I would think, but I don't. Oh man, going back to when I really used to read about this, it wasn't as far a reach as like a month difference. It wasn't that big.
It's not.
It was almost like, you broke your arm. That's not bad. That's just like a little bit worse than the muscle, as long as you're not a dumbass and you let it heal, and it will heal stronger.
Yes.
The only thing that's always confused me is, with you speaking about Donnie showing slides of, herniations that would just go away and stuff like that, and how tissue can remodel and rebuild.
Yeah.
This is just a stupid, whack question that is just dumb things that come into my mind. Like, I tear my pec, why in the hell doesn't it look, after 6 months, why doesn't it look like it did before I tore it?
Well, that's a cosmetic thing versus a structural thing.
Okay.
So structurally, it will be different. It will look different than the other vertebrae, but you wouldn't see it because obviously it's internal.
Yeah.
Your pec. Now, you can, how can I put this? So I've been doing some kind of weird, wacky shit. And so I don't know what I'm doing, but I'm actually able to restore that deficit. So I can fill in the pec, or I can fill in different muscles. And we're doing that through acupuncture. We're doing it through electrical stimulation. We're doing it through laser, a number of other things. And the only thing that I think that it's doing is that I think I'm stimulating the stem cells. So the stem cells can all of a sudden differentiate and fill it in. So I've had, pro bodybuilders coming in, and I'm doing acupuncture, and it's called Surround the Dragon. What it is that, say this is your tear here, so I would use acupuncture needles all around that, use electrical stim, and I would go in from the side, not straight down. And what that does is all of a sudden it basically stimulates that area, and all of a sudden the pec actually starts to develop and fills that in.
Essentially, isn't what happening though is, say I had a total tendon rupture on one of them, so that's a whole different story. I could have not had anything done, and then the tendon would have just laid down into the pec minor, grew into it, and probably bench sucked forever. But pulling it back and having it screwed back in, but there was not a lot of deformity there because it was just complete rupture, which is it's actually a rare type of pec, because it's just boom down, and the whole pec was under my nipple. So, and it didn't really hurt. It didn't bleed. It didn't bruise. I remember Louis saying, "You just pulled it." I'm like, dude, my entire pec is under my nipple. This is one fucked up muscle pull. Yeah. Then the other one was your typical, tear, bleed, that type of thing, and tendon still attached. But I'm smart enough to go and get it looked at, because that's all I want to know, is the tendon attached or not? Because one means surgery to me, the other one means no surgery to me. Yeah. That's not somebody else. I got to be clear here. Yeah. To me, I'm never planned on competing as a bodybuilder, but I will say at the same time, I never planned on working with Justin Harris or John Meadows and getting really lean and realize that both pecs are going to look like a car that got smashed. But I wouldn't have changed anything with it anyhow. But the pec, essentially my pec major it's now grown into the minor. So if you're going, say, where there could be the potential to get the pec to grow, the minor to grow, more, to kind of like maybe fill in that gap potentially, or getting the other that's grown into it to start to grow.
Well, the other thing that you can do, so I had one of my patients, he was benching, a multiply shirt, and he was benching 700, 800. And so he had a pec there. He weighed about 350. And he was actually Swiss 2015. It was 10 centimeters long, 4 centimeters wide, 5 centimeters deep. The guy weighed 350. But it's a huge, huge tear. Usually that's, especially in the center. Like, I mean, if it comes off the bone or anything else, you can screw that back in. Trying to get, put that together, you can't sew. It's kind of like Kleenex. You can't sew that together. So I sent him to a friend of mine, Dr. Doug Stoddard, who's a medical doctor. And under diagnostic ultrasound, he used PRP and stem cells. And I think it was 3 or 4 treatments. And it filled in. Took about 7-8 months to get him basically back to around 700 pounds. But he did a ton of rehab. Like, when he came to me, he says, "Oh, can you do some acupuncture?" I went, "Dude, it's torn." Like, I mean, this is way beyond. I think one of the things that you also want to look for from a practitioner is know your boundaries. Like, I mean, if the friggin' thing is torn, I'm the last person that you should be seeing. So I said, go see Doug. He's going to be doing it. And it worked out fantastic. It doesn't happen all the time, but it restored it. And then afterwards, he worked with the earthquake bar and, proprioception. I did a ton of acupuncture. I did some soft tissue work. I did laser through the whole ball of wax at him. And he was basically under a year, he was back benching heavy again, which is fantastic. So usually that's a career-ending type of.
Yeah, let's stay on pec tears because there were a couple of questions about that, and I think because of my history with it, and I dodge it sometimes. Because I don't have a practitioner, so I'm sitting with one, so I can kind of tell, tell my story from that, and then you can tell what you help people do. But I had 2 different type of pec tears. I'm not going to talk about the tendon rupture because I think it's too rare. It's not going to make any difference. But long story short on that one is that started happening right after high school, and it was just a pop. And it's like, well, what the hell? And 3 weeks later, it was functional and it was fine. And I probably had that little pop thing happen 20 times, and easily. And it's just, it had to be technical. It had to be something that I was doing technical, or, a tendon takes a long time to heal. Me never giving it the time to heal, but eventually that's the one that just popped, blew out, it had to be screwed back in. And then when I came back from that, and this is where I think people have issues with both types of pec tendon. I had a lot of scar tissue because they go in there, they do the surgery, they reattach it. The scar tissue's got to lay down there. I'm not taking time off training. So I'm going to be tearing scar tissue. I'm not giving it the time for it to lay down, completely kind of go away and come back. And there's pros and cons to that. I never wanted to miss a meet, so I didn't give a shit. If it tore again, fuck it, it tore again. And once I realized it was scar tissue, it really didn't matter. It was just, okay, it's going to tear. As long as it doesn't happen 2 weeks before a meet, I'm cool, because I couldn't get a bar off my chest. But then after that, it would come back. But some of the principles some of the things that I did for my pecs, for both of them, to be able to keep competing. And yes, I wore multiply. Yes, I wore gear, but that was how I was brought into the sport. And that's the only options that we had. And my raw bench still did go up, but my focus was on the gear. I had to change my technique. That was the first thing I had to do. And Louie and I spent hours trying to figure out how I could bench and not activate my pecs at all.
So what exactly did you do?
We went to a thumbless grip, turned the wrist a little bit more, made sure that it started way out in front. And then as soon as I started bringing it down, I made sure all the tension was on the elbow and tricep.
So you turn it to a close grip bench press.
Yeah, or wide, So then pressing in that straight line coming back. If my elbow started to turn, then I had to bail. I just quit pushing, because if it turned, that put the tension on the pec, and so I had to condition myself to never turn. And that ultimately hurt me later down the line, because that's how bench shirts work, is you get it to a certain point and then you got to glide back. Why I didn't have that ability to glide back, because I was so taught to push towards my feet to be able to do that. So I forget who the university was that came in, but they were hooking up EKG, I don't know what you call them, but muscle EMGs, and testing everybody on the bench press. And they were hitting like 60% pack, 40% tricep, and they're kind of all over the place. But we were all tricep dominant. I was the only one that had 5 on my pack. So you could literally, and I could probably do it now, I could lay on the bench and bench, and you would not feel my pecs contract.
Wow.
So I was able to completely take it, but that meant my arms had to get a hell of a lot stronger. And I'm not saying that this is the answer for everybody, but I had 2, right? My left and right. And I was already dealing with imbalances, because the left one went first, and this is that toilet bowl we were talking about. Yeah. The left one went first, years later goes the right one. And then years later, there's an imbalance between, front and back on the right. So there goes the supraspinatus. So then that has to be corrected, and then there goes it's a constant, especially when you're not taking the time to let your body re-educate. I used saline on a weekly basis going up to a meet, which I think is really no different than acupuncture, to be honest with you. It's just the saline injections. I don't know if the saline did a damn thing. I think it was just the needle tearing through the muscle tissue, creating it to bleed. But it was a regular Friday occurrence, and this was before PRP, before stem cells. It's just one of the guys in the gym happened to read a little blurb in Penthouse. I shit you not. They read a blurb in Penthouse magazine that said that doctors were going in and flushing knees out with saline, and people's knees were feeling way better. So we're like, fuck it. Next time we pull something, let's shoot it with saline. What's the worst thing that can happen? It's just saline, and then it was, well, let's try peroxide. And, we found out that was a whole nother game there that I didn't want to fucking do again. But that, I think, marginally helped. You may be able to expand on that, because maybe it helped more than what I thought it did. What I think helped more than anything else was the change in the technique. I always put in ultra high rep reverse band presses. So I would do, at the end of every training session, a weight where the bar was at 0 on my chest. So a green band, I think it was 95 pounds. A blue band, it was 100, or a plate per side. So 0. And the goal was, and this again falls back on Louis, you need to do 100 reps. So the first time I tried it, I could only get 50 because my triceps were burning so fucking bad. I still got 100, but I had to rack it. The whole goal here was to not let the triceps and shoulders do the work. Let all that blood go into the tendon and the muscle, and try to keep let the bands do the work. And it took a while, but you learn how to relax, you learn how to breathe, and just let the bands do the work. And might have taken 3 weeks. Then after that, 4 times a week, every week, if it was at Westside or the club I worked at, I did that diligently. And after doing that, I never had another pec issue again. Avoiding things that were hard on the tendon. I completely stopped the shit people think you need to do. Machine flies, dumbbell flies, any type of fly. All I thought was, holy shit, this is just a lot of stress on an area that has no muscle. This is stupid. I'm not going to do this. And I have an article. If you search Dave Tate pec tears, you'll see, what I did. And that's all I can really tell people is what I did. I can't really tell them what to do. But I did never miss a meet, which that was my own mentality. Some of them I should have not done because I didn't hit a PR. I just hit an opener, but the risk could have been traumatic, especially with shirts and bars falling on your face and stuff. But expand on some of those principles that I was using if they were stupid. The other thing that I did is if it did pop, and this I really believe in, and I've had some orthopedics agree with me, physical therapists agree with me, other ones not really, but I think it depends upon the mentality of the lifter and the experience of the lifter. I always did max effort work. So the week after it popped, or the day after it popped, if it was, as long as I had to have full range of motion. And nothing happened until I had full range of motion, not even saline, nothing. I had to have full range of motion. Even if it hurt, I had to have full range of motion. That was kind of my golden rule, is that has to occur. For me, being a power lifter, that meant being able to touch the bar to the chest and lock it out. All right. Not full range of motion for the actual pec. All right. Full range of motion for my sport. Then if it was max effort work, I remember after one of my shoulder surgeries, the surgery I think may have been on Monday. It was that Wednesday. No, I was still in the sling. It was the next Monday. I did a reverse band press where the bar was maybe a pound to a 4 board, to where somebody I couldn't get my arm up. Somebody had to pick my arm up to the bar, then lift it out and then lower it and then press it off the 4 board. And it hurt. Mm-hmm. I'm not going to say it hurt like hell, but what I will say is it didn't move very fast. But every time I did that over a period of, say, the 3-month recovery period, forget about the physical aspect, but I am building the stability, of the muscle and the joint. And my mind is what I wanted to deal with. I wanted to strain. So if I tore it at 455, when I got back to 455, I didn't want to be thinking, oh shit, this is where it happened, because by then I already strained hundreds of times for 3 or 4 second concentric periods, putting that muscle under tension. And keep in mind, I am not saying you're going in there and maxing out balls. You're pushing as hard as the muscle will allow you to push without getting psyched up, mm-hmm. and all the other kind of stuff, and making sure the form and the technique is all good. But I think that takes that mental component and makes it easier to deal with later down the line. I've had some people tell me I'm a complete fucking idiot. Other people tell me that as long as you're an advanced lifter and you know where that threshold is, it's one of the best things that you can do because you're moving it.
Well, I think there's a few things on that. Number one is when you're doing that tension, because if you're using a reverse band and you're bringing it down and there's only 1 pound on it, it's not a lot of stress, but it's enough stress. And what we've seen post-operatively, and everyone has their own ideas, and because to be honest, we still don't know. But one of the things that we do see is that with the amount of stress, it will actually orientate all the scar tissue. So as it's laying down more and more tissue, instead of it being all in kind of like a pickup stick, it's all over the place, because of the tension, it will start to groove into that pattern.
No shit.
Yeah. So you were actually doing the right thing.
Yeah.
It works really good with advanced lifters. The reason why I say that is that you lift under control. With a novice, they basically go down too quick. They're not in control. Your descent is so slow that you're putting the tension on, but it's enough that to not injure it, but to actually create the orientation of the actual tissues. We're seeing that more and more with advanced sports rehab type of aspects. So post-knee surgery, they're putting them on a bike as fast as possible. The second thing is that you're changing the nervous system. The way that you block pain is you fire off mechanoreceptors. I don't know if you're aware of that. So you have 2 different receptors. You have nociceptors, which are pain receptors, and you have mechanoreceptors that are in the joint. So say I'm hammering and I whack my thumb. The natural instinct is to start to move it. You shake it out, and it blocks the pain, because the mechanoreceptors will block the nociceptors. So this is why for certain people, walking is fantastic. It's motion. Weight training is good. John F. Kennedy, he had horrible low back pain. So what did he do? He was in a rocking chair all the time. He couldn't sit, but he could sit in a rocking chair. So as long as he was moving, he didn't have pain. So you're changing it just by doing the motion. You're actually creating your own pain block by doing the actual exercises. To get back to the repetitions, Ken Lane. So I was in a seminar with him. Smart guy.
Oh, yeah.
Strong as hell. And I didn't realize it, but he owned a whole bunch of chiropractic clinics.
Oh, did he?
Yeah, down in Texas. So what he would do is he would periodize, and he would do a certain amount of weeks, low reps, certain amount of weeks, bodybuilding, and a certain amount of weeks, high rep.
Like ultra high.
Ultra high.
Okay.
And so I talked to Ken personally, and I said, why do you do that? He says, the capillarization. He says, I want the nervous system to rest, and then I'll shift into the muscular system, but the capillarization will allow more blood vessels into that area so that when I go back, the nervous system is actually recovered, but now I have more blood, more nutrients to actually fire. And what the guy set bench press records in 3 weight classes?
Yeah, and I understand the validity of that. The only thing that's going through my mind, is, I process and think as you're speaking is, would that work better as a block, or does it work better as, because I used to do time work, say at the end of a training session where it's the holding a tsunami bar or holding a bamboo bar. I can't actually do the movement because of the joint structure and the pain, but I can hold it. So I'll hold it for a song. So that makes me wonder if the output or the result would be better using that as a short 2-week transactional phase instead of at the end of a session, which I'm sure helps. But from what you're saying here, I can see the far greater benefit in making it part of, even after a post meet, going through that rest period, then starting with 2 weeks of that, and then bridging that into the strength phase and going from there.
Yeah, you can change it. You can do the active rest type of thing. Again, depending on what you're doing, and you need the nervous system to recover, the peripheral nervous system, and also the brain itself, emotionally, mentally, and also centrally. So I think a lot of that is we're still trying to understand it. We're still trying to get some ideas of how everything works, because look at that, the whole idea of the concussion. Did you watch that movie Concussion with Will Smith? What that guy had to go through, literally, just to say, guess what? It's bad. And then they came out with the study, out of 111 NFL football players, 110 of them had severe brain degeneration.
Yeah. And those are the ones that are willing to participate.
That's right.
Right. So, you deal with any high-end athlete, even if you're asking them just PEDs or whatever it is, you're never going to get 100% compliance across the board with 100% of the people.
No.
You're going to get a lot of partial compliance, and you're going to get full compliance from some. But I think enough to be able to start putting pieces of the puzzle together. And I think that in today's world, people complain about a lot of the things that are going on. I think that the communication between strength athletes, at least, because, that's my realm, and practitioners is better than it's ever been.
Yes.
So
it's a mutual respect.
Yeah.
And I'm starting to see that more and more. You have certain trainers that think that they're also therapists, and they take a weekend course and they think they can fix anything. And then you have the doctors that have read an article, online and, figure that they know about training, which they don't. So those are the people you don't want to listen to. It's well-intentioned bad advice usually. But what you do want is to have someone that's been doing it for a long period of time, that it has an open mind. Because the stuff that I believe, and I think similar to yourself, I've seen weird shit work, and I'm like, that makes no sense whatsoever. But for certain people, it work. Classic example. In 2001, I had Dorian Yates come out to present at Swiss. Super heavyweight, low reps, low sets, 6-time Mr. Olympia. 2002, I had Lee Haney present for me. Exact opposite. High amount of reps, high amount of sets, low weight, 8-time Mr. Olympia. And I'm like, you got two polar you couldn't find it more polar opposite, and yet they're both Mr. Olympia. So I chatted with Dorian. I said, did you ever do the high rep stuff? He says, yeah, didn't work. I asked Lee Haney, did you ever go heavy, the hypertrophy? He says, yeah, didn't work. And I went, so part of the art of training, what I've seen is that what works for you. And we don't know that yet from a hormonal standpoint, from genetics. Everyone has their own style, and it's basically trial and error. So we don't even know what type of diet that you should be on. And that's been my passion for the past 20 years. Should be high fat, high carb, high protein. because we're so metabolically different. And I've seen all the different types of diets work differently for different people. And again, it's been trial and error. There isn't any specific blood test or urine test or anything else that I've seen that's sort of like, okay, this is what you need to do now. I think we're getting closer. Part of the challenge that, the big thing now, that everything has to be evidence-based, whether it be training or rehab or treatment or anything else. The problem with evidence-based is that it's all based on, are you able to measure it? So our technology, it's getting better. Like when I went to school, they said that, the disc has no nerves whatsoever. Completely, there's no nerves. Now through proper staining techniques, they can look under the microscope, new staining techniques and all that. They find that the vertebral disc is the most innervated tissue in the entire body. It has nerves going into the actual disc and nerves actually leaving the disc. Hey, 20 years ago, didn't exist. So I think the biggest thing is always have an open mind, see what actually works, even if it's empirical, and then sort of go, okay, and it might be just for that problem, that person. And the challenge that we have with different coaches or different doctors is they get locked into, okay, it's worked here, and they're not willing to say, maybe something else will work.
And it may not work again. It's the thing is, when I work with coaches on what I call developing their training philosophy, there's a lot of programs out there. There's a lot of methods. There's a lot of different paths to go through. And what I think most coaches miss are a lot of the methods and the programs that they're looking at is just somebody else's philosophy of training. And they know how to pivot and auto-regulate that to the athletes that they're working with. And if they're good, have a very high success rate. Not 100% success rate, but a high enough success rate. But it's not based upon the actual program. It's the philosophy that they've developed on that. And throughout that philosophy, you need to know what, kind of a Stephen Covey thing, you got to begin with the end in mind.
Yep.
What is the end here? If you're a high school strength coach, what is the end? When they're done with their 4 years of training, what should their end be that you define? You're the coach. What is that? And they don't know, or if it's a personal trainer working with a Gen Pop, what's that end? Well, just to be fit. Well, what the fuck is that?
Exactly.
Give me a half hour, I'll give you 200 different indicators at scales, of thousands of people from 0% to 100% on different indicators of fit. Like, here's how many push-ups they should be able to do, how many pull-ups, here's a ravage pie. I mean, it's just any study that's been done on any exercise, body weight, blood work, body fat, whatever it is, will show here top 25% are fit. So out of all those, which are most important, to your end goal? So defining that end goal, I think, is the huge thing. And then to back it off of that, what indicators are going to determine if you're on track for that end goal? Yep. So powerlifting's simple, right? The end goal is to either win a world championship, have a pro total, whatever it is. The main key indicators are squat, bench, and deadlift. Then you're going to have indicators to determine what's driving or what drives those, and just work backwards from that. Most trainers, practitioners, and everything that I see start here and try to work up a pyramid instead of working back. And in their defense, a lot of times they might have a client that comes in that may be there for a week. So you can't really define an end goal. That's why I'm not a trainer anymore. I did it for 10 years. You spend a lot of time working with people to try to figure out what that end goal is, because it completely changes. If you had an athlete come in that's a professional athlete that was going to work with you on a regular basis, all right, see that even I can't define that, because the times per week are going to depend upon what the overall structure of the plan looks like. For 4 years, it's like, okay, I want to be in the Olympic trials. All right, so we're 6 years out or whatever it's going to be. you're like, okay, we got 6 years. This is the end goal. Here's where we are. Now you can actually, once you get, hopefully they have a coach that has a solid training program. Once you get a template of their training program, then you can go in there and say, okay, here's fundamentally what needs to be laid out after you've assessed them. And then over time, you're going to realize this modality works really well. Okay, we're going to hold this and we're going to push this during this high peak training phase. This modality is okay, so we're going to use that during other phases. During these light training phases, you know what? I don't need to see you for 8 weeks. So that's that's what we all wish we could have, right? Yeah. But we don't. So we have to work in this gray space, which is kind of in between, which is where I think a lot of the crazy things pop up, because it's like, hey, you can come in, we can do this, and it will fix it in a day. I think when people are looking for practitioners, albeit physical therapists, obviously chiropractors, doctors, they need to seek people who work with people for real, like not just online, like in person. Yeah. Because there's so much nonverbal that goes on with assessments that you're just not going to pick up through a video.
Well, you can't even assess someone. You can't assess someone properly online. Yeah, sure, you can watch them lift and all that, but there's so many different nuances. You can look at the macro level, but what about the micro level? How does the shoulder actually move that when the bar isn't in their hand? Or how do you move through space? And some of the different even movement patterns that you can assess. And John Rusin is really good at that, as far as really looking as far as where do they break down. I do muscle testing, so I go down to the micro level. I'll watch you squat, and then I'm like, well, that's weird. And then I'll test it, and it's like, okay, these things are being inhibited. I have no idea why. Could be a muscle problem, could be a joint, could be a nerve, or it could be all of them. And then I got to fix all of them all at the same time. And then let's see if it made a difference. And if it did, great. And if it didn't, let's try something else. And there's some kind of other maybe neurological aspect, or maybe your technique, you haven't grooved it in enough, and now we got to do repetition type of work to try and restore the motion back into the way it should be, because if it's been so altered, for you to do an old style bench press now, because your brain from the motor pattern is
there's no way.
There's no way. Even if the pec was 100%, if they came up with some new treatment, it would take you literally probably 4 to 6 months to change that motor pattern so that you could do it properly. You just couldn't swing the elbows out and expect a great result.
Yeah, looking back, I can say that, the change in the movement pattern I had to make to be able to keep competing is the change that actually destroyed my shoulder. So, it's a give and take. Let's go down this road of muscle testing real quick, because this fascinates me. It always has fascinated me. The first time I was exposed to it was when I was in college. And I was seeing a chiropractor at the time. And for me, people are asking about, how you should cycle training modalities, if there should be periodization with it, and we can discuss that. And yes, I do think there should be. And I'll let you kick that off after I get through this. He was using what was called Touch for Health. All right. So it was just basic muscle testing. And sometimes the solution would be, put this glandular on the top of your mouth, then retest. I'm like, and I'm trying my best. Like, you're not going to do it. It's like, this has got to be mental. It's fucking with me because it's making me mad, for one thing. And I used to get mad a lot more back then than I do now. But I'm like, this just doesn't make sense. And then sometimes he would get one that it just wouldn't stay. It just wouldn't work. It just would not go. It wouldn't go. It wouldn't go. And it's like, okay, now he'd flip me over. Then he'd adjust me. So his adjustments were based upon, like, okay, we're going to try all these other things first. If they don't work, then boom, we're going to go and we're going to adjust your upper back strong. Like, okay, what the fuck? And he would be sweating on the table. He worked his ass off, and it helped me tremendously because, college, I'm not going to say my life was hard, but I was working 3 jobs and going to college and training being my top priority. And he loved doing what he was doing. So I gave him a opportunity to work on a non-common specimen. Myself, I think Bob Wall went with, saw him as well for a long time, and that was my referral. Wow. Bob was he was one of my training partners and mentors, and was trained with him for 3 years in Toledo, and just a technician, big time technician. It's probably a lot of my technical, I'm known as the guy that gets mad when people's technique's wrong. I mean, that stems from Bob, it stems from George Crawford, it stems from Louis. It all kind of reinforces itself. And but what I found through that time period is chiropractic was my gold. It was my go-to. It's like, I avoid this unless I absolutely have no other choice, because my shoulder will hit nerves and will start migraines. I get adjusted, it goes away. I'm scared to death that if I got adjusted all the time, it wouldn't work anymore, and then I'm screwed because nothing else works. So it's always, and it's rare. I may get adjusted 4 or 5 times a year. I don't do it for maintenance because I got other things that I can use for maintenance phases. But I learned through that this is, and maybe he just fucked with my head, and put it in my mind that, hey, your last resort should be chiropractic, because that was his last resort. It would be the muscle testing. And like I said, at the time it was Touch for Health, but then I later realized this is applied kinesiology. Yeah. So then I took a course in applied kinesiology, but then it still roots back. And it just seems to me, and this is why I'm asking you, it just seems to become rebranded over and over and over, or is it actually evolving instead of rebranding?
I think what I've seen over the years, so I've been done applied kinesiology for even before I graduated from chiropractic college. So I was taking courses in the late 80s. And just with Dr. David Leaf, I've taken 120 weekend seminars with him. So I told David that, and David, and his strength is not social skills. So he basically said, well, either I'm really good or you're just really stupid. And I went, well, I'd like to go with the former.
Yeah, he's really good.
But what I would learn in those different courses is that there's so many different ways. In chiropractic, there's 220 different techniques on how to adjust the joint. Like, it's just unbelievable, the different types of techniques. Dr. George Goodhart in the 60s basically took Kendo and Kendall, which is the original muscle testing, and it started applying it to, okay, let's find out if the muscle fires right. And if it doesn't, why doesn't it? And there's just a whole bunch. And George was smart. And what he did is that they called him the Dirty Dozen. This was back in the 70s. And he went to all these top chiropractors and physical therapists and medical doctors and all that. And he says, here's muscle testing, run with it. So certain people would do the emotional work, certain people would do the nutritional work, certain people would do more of the muscular work, which is more David Leaf style. And as far as, testing for performance, and is it a muscle problem? Is it a joint? Is it fascial? Is it, all these different things. And then he would pull it in from, Bennett reflexes and, Chapman reflexes, which is the whole be activated, RPR. So you're doing different reflex points. And then in the 70s, all of a sudden acupuncture. So he pulled in acupuncture. Then he, hooked into some of the craniosacral people, Upledger and everyone else, and put that in. And so he was a great aggregator of many things. So he would say, okay, 90% of this stuff is dogma. It's just made up shit to just explain, here's the golden 10%. So he would take acupuncture, which is huge. How can we actually make the muscle change? How can we change different areas? How can we stimulate different areas? And he basically would put temperature gauges on you. Say someone came in, a woman with thyroid, hypothyroid, seeing everyone and everything else. And there's a specific case. I remember this one medical doctor, and she went to see Dr. Goodhart, and no one could fix her. So he said, okay, let's put the temperature gauge on you. And he was able to stimulate different points on her friggin' head. So now we're looking at scalp acupuncture. He was able to reflexly change the actual sensitization in these different areas. And all of a sudden, her body temperature went up, just laying there. And she's like, how the hell are you doing that? And it stayed there. So there's so many different ways that you can do it. And the muscle testing, it's a qualitative test. It's not really quantitative. What I mean by that, it's kind of like a yes/no. So if I put a remedy in front of you, and people muscle test, with different remedies, and is it accurate? No. Is it? So I get criticized of this all the time. People say, "Oh, it's not accurate." I agree with you. It's not. And so if you have 5 different adrenal supplements in front of you, and I know that you have adrenal fatigue, you're sensitive to sunlight. If you lay down and get up, you get a little bit, dizzy. It's fainting. Your immune system is compromised. Those are classic, adrenal issues. And you got 5 different adrenal supplements. And the way the public looks at it is that they'll read the front label and they'll go, "Oh, it's for adrenals." And they'll buy it. Health practitioners, chiropractors, personal trainers, nutritionists still turn the ball around, and they'll look at what's in it and the dosage and everything else. And based on that, they'll make the recommendation. That's called guessing, and I guess all the time. Like, I look at it and say, I think it's right. I tend to put the actual substance in the mouth, so I do this for adrenal testing, where if the molecular weight, if the size of the molecule is small enough, underneath the tongue, there's a capillary base, and you'll absorb the nutrients in about 10 to 15 to 30 seconds, and it gets into the bloodstream. We see that with people with angina. They take nitroglycerin. We're just using the same pathway. The Nazis, they would use cyanide. Crack a tooth, 10 seconds, you're dead. So we know that pathway works. So all of a sudden, you see a change. Is it super accurate? It's more accurate than guessing. It really is. So I think with the more things that you can assess and test, and based on that, by the x-ray, the MRI, the blood test, the biggest one is just the symptoms. How the heck is the person actually even feeling? And we're seeing this with the whole TRT aspect, as far as, okay, you're in the optimal level for, your testosterone. You're like, yeah, I still can't get it up. I'm not motivated. I still feel like shit. Because it's probably not high enough, even though you're optimal. So with the actual muscle testing, you can use different types of things. Certain people rebrand it. That's more from a business aspect. And I've seen that more and more. And we're seeing that almost monthly up in Canada, where someone comes up with a whole new technique of muscle testing. It's like, it's the same old. But it does work. If it's done ethically, if it's taken in consideration that it is not 100% accurate, but neither is taking your blood pressure. What is blood pressure?
Well, it's that specific moment in time, too. So if you take your blood pressure, you know what it is that moment.
The other thing, though, is that if you use a stethoscope and you put the blood pressure cuff and you pump it up and you listen to the lub-dub sounds and everything else, your blood pressure is based on the doctor's ability to hear properly.
Oh, yeah, trust me, I know that. And it's their ability to actually take it properly.
Yes.
Your arm should be out, it should be supported, it should be relaxed, it should be above the heart. You'll be amazed at how many, the people listening would be amazed. Next time somebody takes your blood pressure, see if your arm is up, pretty much tucked under their armpit, completely relaxed, the cuff being the right size.
Yes, that's a big one.
Yes, mine can go from being like 180 over 150 to being 127 over 76. One being done in, a clinic that has no idea what they're doing, another one being done in, a hospital that specializes in heart, you know what I'm saying?
Yeah.
It's just, and then you learn, and it's your responsibility as the patient that you need to learn how they're supposed to do some of these basic things, especially in today's society, because if it's always that high, 180 over whatever, 120, you're going to be on blood pressure meds that you don't need to be on because they didn't know how to take it, because they just have your arm laying down to your side, and that's a scary ass thought.
That is.
Because I can go back and say that maybe 2 nurses I've seen in my life actually did it correctly. Correct. Once I learned how it was supposed to be done. And so now the cool thing here in the States is, and I don't know how it is in Canada, we can use, and it's not really for blood pressure, but just for blood work. I can send an order into direct labs, go get my blood drawn, I'm going to pay for it, obviously. Yep. I get the results. Insurance company sees nothing. Doctor sees nothing. I have everything I need right there. My doctor's cool, so I take it to him. He didn't yell at me last time because everything was corrected. But I was able to do it frequently enough. And This is another thing. Some things will change fast. Some take time.
Yes.
Cholesterol can take time. Vitamin D, if you're on the right supplement and you can get out in the sun if it's not winter, can actually make a pretty big difference. If you're at a 10, you can go up to a 50 in a month.
Yeah.
But most supplements suck.
Yeah.
So that's.
Now you can find out which one does suck.
Yeah. And then the cool thing with, everybody knows Eric's my doctor. The cool thing with Eric is he can say, look, your DHEA is down.
Yep.
That's what's impacting this with your cholesterol, so let's get this up, so then we'll see what happens with cholesterol. Lo and behold, there it's fine.
Yeah.
And who would think, what I'm saying? I don't have the time to be able to look that deep.
And nor should you.
Into all those cross correlations that just mind boggle me when he starts drawing shit on the board. And it's like, this one matters, this one matters, this one matters. And then this one, fuck it, it doesn't matter. I'm like, well, wait a minute. This one, everybody else is telling me I'm going to fucking die from. No, it doesn't matter. Here's why. He sketches it all out. And it's like, you tell your doctor. I'm going to go tell my doctor. But anyhow, you got to trust who you're working with. And I think you kind of touched on this, is you have to have somebody that looks holistically.
Yep.
I think you also have to stay with that person for a long period. They have to get to know you. You need to make your regular visits, even if it's quarterly or every 6 months, because they got to know your personality. They got to know when you're bullshitting them, when you're not bullshitting them. And then they get those markers to be able to say, yeah, this is high. With Eric, I've been seeing him since 90, I believe. Yes, this is high, but you know what, Dave? It's always been high.
Yeah.
So that's your normal. So this is not a problem. Now these things, and go from there.
Yeah, I agree. And even from a manual standpoint, I have 3 different chiropractors. I have one chiropractor. She is unbelievable with the upper cervical adjustment. Probably one of the best in the city. Lower back, okay. I go see someone else for the lower back. We all kind of specialize in different areas and are good. Physical strength, technique, everything else. And we see the same thing. So I think you should you build a health team.
Yes, most definitely.
You deal with, naturopaths that are on board. You deal with medical doctors or even multiple medical doctors to try and get advice, because everyone has sort of a little nuance, no different than trainers. And then, you have different, people work on you, physical therapists, massage therapists, osteopaths, chiropractors. Everyone has their own little style and abilities and gifts. And some of them are just very, very good at one thing, which is fantastic. Go see them for the one thing. The other stuff, I'll go see someone else. And that's what I found over the years, is to really seek out people that, boom, trying to find the best person to do everything is technically impossible.
No, to me, it's like Eric's a global person. It's like, here's a problem, here's a suggestion, or here's a referral.
Yeah.
From that standpoint. One question that hit my mind when you're answering that one is, when you get adjusted, should the patient feel or hear the whatever you're adjusting? Should they hear the audible?
No.
Okay.
It's all that is the gas bubbles popping. So if I take my finger here and if I pull on it like that, it just popped. It's nitrogen gas being released in the joint. I can't do that for another 20 minutes, but I can still mobilize this.
Okay.
So for certain people, when I adjust them, huge amount of sound, great. And what I'll do, the style that I do, is that when you come in, I'll assess you, I check your range of motion, I want to see how you walk, everything else. I'll try and test as many muscles that are relevant to what the problem is. I'll go through, I'll do any type of treatment, whether it's percussor, acupuncture, active release, laser, whatever that you actually need. I'll do the adjustment. It may pop, it may not. I'm not attached. At the very beginning, I was really attached to it. And what you do is you tend to hurt people, because now you're going after something that doesn't even necessarily need to be done, and nor will it ever move. So I just go back and I check your range of motion and I see if the strength was restored. If it is, we're good. So that's sort of the misnomer. I know a lot of people are, oh, you didn't get it. No, it moved.
Yeah.
Trust me.
I'm going to pivot here in one of my notes, and I did go look this up. Actually, I think this is the note that I gave them. I saw on your Instagram that when you were traveling, you were reading This is Marketing
Yeah,
by
Seth
Seth Godin. I've read a lot of his stuff. I've read that book as well. What were your takeaways from that one, or just him in general, from a business standpoint?
You know what I like about Seth is that he allows the community to tell him what is actually going on. The challenge that I have with a lot of people is that they think that they know what is best, and we see this in websites. I'm going to build this website or this product. You put it out there, nothing happens. Why? Well, they may not want it. So the whole thing is that, you know, the individual, and he talked a lot about tribes, you know, and I think we've gone from that, and we see this with the CrossFit, the F45, the Orange Theory, the Soul Cycle, all these different tribes, and everyone comes together, and all it is group fitness, but in a more extreme or more specific way of that. And when you build that community, because I think because of the internet, people actually think that because they're friends with me on Facebook or Instagram, that I'm their friend, you know, and I'm not. I don't even know you, and vice versa, you know, to make that assumption. But we think that we do, and it's almost like, you know, a distance type of aspect. What we want to find out is that everyone is a little bit different. What is it that people want? We're dealing with multi-generational challenges. So I just had this conversation yesterday with someone that does corporate training, and you have a CEO that's military, that's 50, 60 years old, who now has to work with someone that's in the 20s, who's a millennial, and so you have the class of cultures. So what they've done, well, up in Canada, is they're starting to flatten the hierarchy so that the CEO has his say, but so does the millennial. It's the same level. And so the CEO's like, what the hell just happened here? You know, and they don't know how to talk to them. They don't know how to, you know, engage them or anything else. And it's just two completely different cultures. So I think what Seth has been talking about, and he talked about the purple cow, and you're definitely that in the sense of you stand out. Like the amount of information that you produce is astronomical, and it's free. And it's good. It's the best in the world.
You know, he had another book called Free Prize Inside.
Yeah, Free Prize Inside.
Which is, you know, one of my favorites.
Yeah, you know, so, you know, he's always looked at what is actually working in the industry. And he always looks at it from a metaphorical standpoint as opposed to factual. He can still pull the facts.
Yeah.
But here's an interesting stat that recently learned. You are 22 times more likely to remember a story than a fact.
Oh, yes.
So if you can build the facts into the story, and so what is the book? The book is a bunch of stories of all these different people and everything else. And I'm starting to see, you know, I've been running Swiss for 20 years. And, you know, back in the early 2000s when I was doing it, mailing was my number one way of communicating with people. So, you know, put a stamp on and mail it to you and everything else. In 2018, I got a mailing list of 500 gyms that were in Ontario and Quebec, close by, each of them in hardcore gyms, 10 trainers per gym, so 5,000 trainers. 4-page copy, here's a huge discount, here's why you should be there, this is who's coming, it's going to be spectacular. Out of 5,000 trainers, so 500 gyms, 10 trainers, 5,000, one signed up. One. And I'm like, what the heck? 67%. My Instagram is tiny. 67% of the people that signed up to Swiss was through Instagram. And, you know, I got 5,000 people, you know, and they would share it and everything else. And, I use Shopify, so I'm able to look at the metrics and everything else. I didn't even know that. And I didn't even do any ads. I did nothing. And, you know, I put my money elsewhere. So I think the whole thing is in marketing, really understand, and again, you got to measure, you got to see where it's actually coming from. So now I'm taking a whole bunch of Instagram.
Yeah, well, it's not, I don't
courses.
think it's so much because I've been in media, since the onset of the company. It started as a Q&A. So I had social media before social media. I'm not going to say I invented it by any means.
Right.
We just had a Q&A that was almost live. The question answered, it popped up. And, from that standpoint, you learn from, those people who are asking questions. You pull them, you learn, and you move forward. And the median changes, so now it's not a Q&A, because when we converted to the site we're on now, we did move to a Q&A platform. It didn't work, so we had to dump it. Now I found Instagram is the Q&A platform. The stories. The story Q&A is more my story Q&A it's more popular than the whole Q&A ever was total on the old site. So, and it's micro stories. I mean, people want to do business with people that they know. The younger crowds don't want to do business with brands.
Yes.
Okay, so that becomes the complexity when you're a brand. That now you got to put your face out more, because of that, to be able to build that story and then build a team, underneath you, which we have team members to build their stories, which kind of kick back into the same overall story that's there. But social media is a weird animal because you don't really want to go full in because it takes so much time if there's not going to be a return. And for me, the Facebook thing, it works for ads, and they've basically built the algorithm to a point that nobody's going to see your post unless you pay anyhow. Yeah. So nobody really gives a shit. I don't think anybody's really looking at their timelines anymore. Twitter, we could probably use better just because of the articles and the news feeds, but you're limited on staff. Yeah. I'd have to hire somebody to be able to do this, and I don't know if there's an ROI. With Instagram, I could see, through the metrics. I'm still not breaking even on my time by any stretch of the imagination because I answer every Q&A. I'm on there 20 hours a week. Geez. I answer every DM, every Q&A. But I always have felt as a CEO of a company, I have to be accessible.
Yep.
All right. So either I give everybody my email and that's going to end up being filtered, so I don't know what I'm going to get, what I'm not going to get. Or I go through Messenger, which is a complete mess. I haven't been on Messenger in years, Twitter, DM, nobody uses that. No. So right now the cleanest, easiest, and they just upgraded it, I saw this morning, to be able to filter messages better.
Oh, wow.
Is Instagram. So it takes time, but I can't answer every single DM. I can do that, and I'm happy to do that. But that's the only place I'm doing that because that's 20 hours a week. So I still have other things I have to be able to do, and I have to take care of, the customers first and so forth. But I'm not sure. I see the ROI, but it's not to a point yet to where I'm seeing it as being a positive ROI.
Yeah.
But it's moving.
One of the things I was in, when I took that one Instagram shot with Seth Godin, this is marketing, I was going to a Kajabi conference. Kajabi is the video platform that I use for all the Swiss videos. So this was the very first one that they'd put on. And there was a guy there, Roland Fraser, works with digital marketer Ryan Dice and all those guys. So he says, it used to be that before someone bought, they would have to see the message 8-9 times. He says it's changed. This is the new stats by Google. They need to see it between 21 to 24 times. So they're calling it micro touches. So all those little questions that you're answering, basically anything.
Yeah.
They're going to go on forums. They're going, before they make any decision, they want to investigate you more and more and more. And to the point, at a different seminar, they basically said 98% of all buying decisions start on the internet, basically on your mobile. Then what happens is that they will use 2 to 3 different devices. They'll use their iPhone, they'll go to an iPad, and then maybe even their computer. Here's the ironic part. Only 8% actually buy it online. 92% still buy it in a store.
Yeah. Oh, yeah. Overall products. Yes.
Overall
yes.
product,
It's still,
but
the growth is just tremendous.
but
you know.
they're still, they do all their research and investigating all online. And then it's not you going in the store and talking to a salesperson
Yeah.
or anything else. They already know what they want. So when they go into the store, they're not shopping, they're buying.
They're buying. Exactly. And if you're an online retailer, that's a challenge, is how do you get them to,
That's why a lot of them are starting to go. And so you have someone like Amazon. What did they buy? They bought Whole Foods.
yes, because the market's huge, from that, and I don't want to get into doing that, but anyhow, the marketing aspect and the way it moves is, the general basics of business, I don't believe have changed in years. It's just how the PR structure has, what you're putting out, the messaging and how the messaging is being done. We're in a weird spot right now where I avoided the podcast for a very long time because podcasts are long form, and I don't consume long form content. I just don't have the time. I don't listen to podcasts. I will listen to an audiobook because I know what I'm going to expect. Like I've read the research of the book. I know the author. I know I can skip through the introduction. I can skip through the chapters I don't really give a fuck about. I can consume the book fast. Maybe I get the executive book summaries, so I get that first. So I already know, and I just want to know more. So that's how I'm going to consume my content from a recreational business standpoint, which is all that is. It's just recreational business reading. The textbooks are where you really learn from. Same thing that training or whatever it's going to be.
Yep.
But I can't sit and listen to a 3-hour podcast, but people love it.
Yep.
And so we started doing it, and then it's doing well. I'm like, well, I can't believe this is doing well. Here I am doing this. And it's crazy. But then you can clip it down, into short bursts, so they will go out to be able to fit that population. But what's weird is the medium content, like just your typical article, 4,000, 5,000 words, straight, kind of to the point, is where we're hurting. The micro content, the little things that I write for Instagram, you got a 2,200 character limit. I know this because I exceed it all the time. Then I got to go trim it. But I do post all the full ones as blogs. So those blogs do better than my regular blog post because it's micro content. It can be absorbed with probably under a minute. And a lot of people on Instagram hate the fact that I'm hitting 2,200 characters. And I'm like, well, I'm trying, but I can't get it done in less. And I'm not going to be the guy that's going to make a 3-sentence, pop this and do this. And I still want to provide value in what I post, if it's humor or, educational or whatever it's going to be. But it's definitely helped the brand, so much so that I don't know what my followers are now, but it's probably close to 300,000 or something around that range, where the actual company, we're trying to build that, and it's at like 40. Now, I started the Instagram way before the company won, so there was a big head start there, but I don't think the company will ever exceed my own.
Probably not, because they want to follow the person.
Yes, so they want to follow the person, and we're going to make changes to the Instagram to provide better content. But with your Instagram and the Swiss Instagram, you're telling the micro stories by putting out the clips, man. Those seminar clips are gold.
Yeah.
And if people aren't following it, they should, because they can just go through the archives that you've posted, and they'll learn more from the archives of a year of your post from the Swiss things than they're going to learn in 90% of 100%. No, I'll be fair. 90% of the seminars they're going to go to.
Oh, yeah.
Just from 1-minute clips.
Yep.
Because you're doing a fantastic job, or somebody's doing a fantastic job
me.
of finding that 1-minute clip.
Yep.
That's like, wow, that's cool.
Well, and I find with any presentation, there are usually anywhere between 3 to 5 real pearls of information. I'm trying to get people down to 1, because that's all the capacity that most people have, is that you do this one thing, it will change your life.
Did it fall to the, because it used to, when I studied it, it was people could remember three things.
Yeah,
it's fallen down to one.
Well, as far as actionable.
From what you think, from what you see?
Because what happens is that if you have three things, which one do you do? Which one do you focus in on? So I heard a cool quote, complexity is the adversary of execution. So the more complex you make something, like Steve Jobs with the iPhone, he just wanted everything down to one button. And his focus before he died is, I don't want a button. And he actually did it with face recognition. But that's what he's always focused in on, is that I think the reading capacity on online, especially on social media, is about grade 2 level.
Yeah, it's low. It's
super low.
Yeah.
But the one thing that I've learned through all the seminars that I've been through is that it's 90 to 95% of the people that watch videos don't turn the audio on.
Yeah, that's true. That's true.
So,
I'm just thinking from a speaker standpoint.
So that's why I put all the captions underneath. And then I use rev.com. You put me onto that. Thank you. And then so I put the actual, that, and then I put the transcript underneath so that if they missed it, it's like, oh, I don't have to watch it again. I can just find
Well, most of the time they're
point.
At work and they don't want people to hear.
Or you're sitting in a waiting room. You're no one socially. It's not acceptable to listen to something, that, especially a seminar or anything else. And no one's going to put their buds in, unless they always are in. But that was the big thing. So the other one I learned was that the headline pulls huge.
Yes.
Huge.
Yeah.
So I put the person's name, what they're going to talk about, and then the captions underneath. And Instagram is only a minute, which is usually about the capacity of what most people will listen to. YouTube is longer. Facebook, roughly about the same, but doesn't pull as well. But the videos, out of everything that I've done, that's probably been the most powerful to be able to distill out the information and not have to listen to the entire thing, which most people don't.
Yeah, see, with our articles, we concentrate on heads and decks, all right, and images, so the heads being the title, the decks are going to be the excerpt, because if you don't get the title, you don't get the excerpt right, you're not going to get the follow through, you're not going to get the click, but then you fall into clickbait. So you have to make sure you deliver on the head. You know what I'm saying? You deliver on the deck, because if they go in and it's like, oh shit, this is not, then either you better be making fun of the fact that you just clickbaited them, or you need to make sure you deliver. And a lot of people don't, and then they don't go back, and then they're kind of done from there. But from a presentation standpoint, the one thing that was really hard for me with Swiss, and we'll talk about my history with Swiss here, because this is going to be fun, was once I really started getting into studying presenting, going to Toastmasters, and I hired an acting coach, and
I didn't know that.
Yeah, a lot of things, and this was before the first Swish, where there's probably more theatrics than what I would use, now. Certain tools that you learn, things to shock people to get them started, but it was always three things. Like, you can only cover three things, and what really threw me off was before Swiss, I don't think I did any conference that was more than just me doing a seminar. So you were one of the first to give me a break,
wow.
Where it was just
a
me.
Monster one.
And it was great. I was grateful for the opportunity. But what really threw me off was, oh shit. It wasn't that I was intimidated by the other people that were there, because either people were going to come or they weren't going to come. And if I promoted it on my site, I should be able to get enough people to come to at least be the same at one of my own seminars. And I've always kind of felt that way with any seminar that I do, that I should at least be able to promote enough to cover the expenses being paid for me to be there. That's, I think, the responsibility, and we can get into this because this will be an interesting conversation. But I really do think it's the responsibility, because a lot of people think that they're big draws, but yet can't take the time, to try to push a little bit to promote to their own group. But what threw me off, and I actually had to get a hold of my Toastmaster person it's been a couple years. I'm like, this 3-thing concept, how's that work when there's 30 other presenters? Because they all got 3 things. So now there's like 100 and some different things, and I got to compete. I want to be the person that when they go home, they remember me, not everybody else. And I don't have to be the smartest, the wisest, the biggest, the strongest to be able to do that. I just have to deliver the best message that's going to resonate. And knowing the demographic of most people that present and the strength in this, I only have 25% of the people to really compete with. And at the time, Ian was a presenter, man. I'm sure he kicked my ass at that one from a presentation standpoint. He knew his trade.
Yeah, but I think what people are looking for, and you and Jim Wendler, you guys did it, and what it was is you actually demonstrated, and then you'd pull people. That's what people are looking for. Not theoretical. Let's see what it looks like.
Yeah, well, I learned from watching Louis present and presenting with him, and then him saying, hey, can you start doing these for me? I started off in using words like cybernetic periodization. I was talking a lot about the central nervous system. I was talking about the eccentric, concentric, amortization phases and all this bullshit, right? That using the biggest words I could use to try to make myself look smarter than I really was. And I confess to that. That was the early flip chart days. DeFranco was at Art Murney. I mean, all these guys will remember this. And then Mel Siff asked me to present with him. It was on a Thanksgiving, and he did Olympic lifts and I did the power lifts, and scared the shit out of me because I talked to him a lot on the phone. He helped me. He was a big mentor of mine as far as helping me go through super training and digest things. And I had a lot of making up to do, from, even though I had a degree in it, I got some of it, but I really didn't get it from a usable standpoint. And presenting in front of him, scared to death that I'm going to fuck something up. I'm talking about strength deficits and, absolute strength, and here's the deficit and all this, but just a bunch of crap that really didn't need to be in there. And we sat that night and he critiqued and we talked for a couple hours, and he said everything was dead on, nothing is being misconstrued. You're 100% factual. You're not bullshitting anybody, but you got to talk to them like they're in 4th grade.
Yep.
And I was like, okay, this is easy for me. This is like, it was like a calling. It was like the best thing I was ever told, because this is so stressful to sit up there and I have a really hard time just saying the word amortization. See, I can't, and I would get close to it and I'd start stressing out. Like, I can't say this. I just want to say stretch reflex, or that, the in-between phase, the shit that happens between, and be able to break it down. And he's like, that's what you should do. That's what you need to do. You're not a professor. You're not teaching them these concepts. You're teaching them how to train and how to become better. And I'm like, oh, fuck, So the next year I came back and he had the same type of thing and I did it. And it's like, perfect. That's exactly what it needs to be. And, but anyhow, with the Swiss, things you don't know about the first one is, it's going to take longer than that.
Well, is JL, he's playing on 130.
Yeah, but you can just walk him through. You know what I'm saying? He doesn't, you know what I'm saying?
Well, he can't be doing that when we're doing this, is that what you're saying?
Well, just distract him. Just make him wait, because we got at least a half hour. Okay. Anyhow, so I'm telling Jim, hey, look, I'm going to go speak at the Swiss thing. And we're working out of the downtown office. He's like, what the fuck is that? I'm like, Serrano told me it was a great place to go speak, And I'm kind of like doing it as Eric wants me to go. He thinks it'll be a good thing. It should be good networking. We're going to have we can have a booth and all this other stuff. And he's like, oh, okay. And I'm like, I'll cover it. And I think you covered him. And, like, it's just taken care of. And he's like, well, what the hell are we going to do? I'm like, just show people how to squat.
Yeah.
We'll show them how to bench. I'm like, it's not a big deal. Won't be a big deal. So we get there, and I mean, if people look at the old videos, we're fucking bloated to the max. We're still competing. It's like, it's
They're
all
awesome.
I remember is there was a bodybuilder there who was competing that I watched that he couldn't say 2 sentences without having to take a deep breath. I mean, it was like, okay, today we're going to talk about, and it was just because he was so, I don't want to use his name, but he was so fucking jacked, right?
Yeah.
And I'm like, okay, I can't be worse than that. There's no way we can be worse than that. So we knocked this thing out, and then it's like we had to set up the booth, and it was in a separate area. It wasn't like in the hallway like you have now. It was like in a little gymnasium.
Yeah. It was, yeah.
And we get there, and there's just a space, and there's a thing on the wall that says Elite Fitness Systems, and there's maybe a table or something. I don't even think there's a table. It's just a space, because I didn't tell you anything. It's just like I don't know what this is. I don't even know what I'm doing.
Was that your first trade show?
Yeah.
Oh,
yeah.
shit.
So I have no fucking idea. I'm like, Jim, we gotta like find some chairs and shit. So we went busting out through the conference center, wherever it was, and we stole a table out of some room, and we stole a couple chairs. And Tracy didn't know it, but we brought in 2 gym bags full of bands.
Oh, wow.
And like wraps and stupid shit like that. And so Jim and I are sitting at a non-covered table with a piece of paper, right, that's behind us. And there's these other booths, and I'm telling Jim, because I've researched this before, I'm like, that's like a $15,000 booth over there. I mean, that one's like $5,000, and it's just us with a table that's got a crack in it, 2 chairs, and we got those white cups with napkins stuffed in them. Chewing, spitting, because we're there a half hour early. So we're chewing, and we just took the shit out of the bags and just dumped it on the table, right? I mean, we don't know what the hell we're going to sell. We just dumped it on the table. And I'm like, Jim, we're not going to be here this long. People are going to come in, they're going to like walk right past, and then they're going to leave, and then we're just going to be able to go rest and sleep, and we'll be cold. And whatever we got to do later tonight, we'll be able to do that. But this won't take long. Fucking doors bust open, and everybody comes our way. Everybody. I mean, there's a line. Like, all these other people have nobody at their booth. And Jim looks at me with the big fucking hawk and the skull in there. Like, what the fuck are we supposed to do? I'm like, I sell the shit. And then somebody comes up and he says, how much for everything on the table? I'm like, $800. So he throws down, and this is like within 5 minutes. So everything's gone. So now it's just me and Jim answering questions for whatever that whole time period was. And then it gets done, and I looked at Jim, and I'm like, we got $800. Tracy don't know about this. We're going to go to the strip clubs later. And he's like, we can do that? I'm like, oh, we're totally doing that. All right, so we end up, oh my God, we end up going to how things have changed, because this was the first one. We end up going to the strip clubs, and then Eddie, we'll just call him Eddie, meets us there later, and he's like wearing a fucking suit and tie, and we're like in sweatpants. And it's like downtown, like expensive ones where I guess you get ripped off.
Yeah.
I'm like just like running through money like it's paper. It's like, what the hell, And Eddie looks at me, and he sees me hand the girl a 20, and he's like, what did you just do? I'm like, well, I tipped her a 20. He's like, dude, that's American, and you understand that's like half you just gave her like
$40.
$40. I'm like, what the fuck are you talking about? Yeah. He's like, there's a currency exchange. I'm like, oh my God, I'd completely forgot. It's like, I was like, fuck it, we're leaving. So I'm putting all the money back in my pocket, which was like $600 left. And I'm like going to the hotel, and I'm like, I need to exchange this. And like, how much? All of it. None of it's coming back with us. And then the second night, oh my God. The second night, we recruited another person into the crew who was, we'll just call him Bo. And Bo knows the strip club landscape from other cities, because I used to work in them, so I hated them, right? It was my job, so I despised going to them. So I didn't even like, I mean, the first one, I'm like, I see exactly what's going on. This guy's hustling this guy's, so I know this game. But Bo, on the other hand, knew how to work cab drivers. So he's talking to a cab driver. He's like, I got the perfect place. And I think it was called like the $1 Million Club or some crap like that. And it was just recently cited for violations of sex or some shit like that. I mean, just not like within 2 weeks. We pull into this place, and it's us, and there's a few other people who I won't mention that are actually big names in the strange community right now. Big names in a respectable way. We pull into this club, and it's like that Selma Hayek movie, From Dusk Till Dawn. It's like you walk in there, and it's just like dirty and gross, and there's porn on the TVs, and I go to take a piss, and there's condoms all over the bathroom, and I come out, and we're all sitting down, and I'm like, dude, this place is awesome, you know. And then the girls start coming around for the table dances, and you want table dance? I'm like, no, I just, you know, I'm married, I don't do this. And somebody in the crew said, well, what do you do? Like, whatever you want to do. A blowjob $10, or a hand job $10, blowjob $20, I'll fuck you for 40. And I'm like, this shit can't be for real. And so as we all got together, I'm like, go get this girl, and we're gonna send him up, right? So we picked somebody in the crew and gave the girl like $100 to say, just take him up there, whatever you do, just, you know, make his life. All right. He comes back down with this grin on his face, like, well, I don't know what, because he had no idea. He didn't hear the conversation of what they even do. So she's probably up there like damn near raping his ass, and he's like, what the hell? And so then we went back and we enjoyed more Swiss, you know, from that standpoint.
Welcome to Canada.
Yeah, but that was our first experience that you don't know about. And but a couple other things with the Swiss, as I've seen it grow over the years, is that I think might have been your second one.
That was 2002. So I did 99, 2000, 2001, and 2002. That was my fourth.
So that was the fourth. Was that before the break?
Yeah. So then
I did one before the break.
Yeah, you did. So I did 2003. We had SARS, that bad infection, so I didn't hold it. 2004. Unfortunately, I listened to too many people, and everyone went, "Oh, you should go after wellness." So that was a complete disaster. And then 2005, when you and Jim came back up, that was the one, and then I took a 10-year break.
Yeah, there was.
That was another really good presentation, you guys.
Yeah,
it was just awesome.
There was a time in between where maybe it was during the wellness time or whatever it was, but I went to a Tony Robbins.
That's right.
Yeah, I went to a Tony Robbins thing. It was one of his Awaken the Giant Within things.
The Firewalk thing.
The Firewalk thing. And a lot of interesting points about that we can kind of get into a little bit is, you know, I'm there, and it's definitely out of your comfort zone because, you know, as soon as the music starts picking up, you need to like dance like a monkey. And I'm like, I'm not a fucking monkey. I don't want to dance like a monkey. So you do it like once or twice to see if you can actually do this. Then after that, I'm like, I can't do this. As soon as the music starts coming up, I'm going to go take a piss. Yeah. All right. So that became my regular habit. And, at one point in time, when I went out for my fake bathroom break, you were out there. And I'm like, hey, you know, so we caught up. I'm like, what are you doing? And I find out that you at one point were working on Tony and followed a lot of his stuff. Yep. And I'll finish my story, then we'll get into, you know, what you've learned from him, what I've learned from him. But it was a way for we reconnected, which was a great thing because kind of lost touch with each other there for a little while. And so that was actually one of the better things. Actually, one of the top 3 things from that whole seminar was just getting back in touch with you. Oh, and but then the whole Firewalk thing. And I just got to tell the story because it's funny. You know, I'm sitting there and I got a football player, like a D1 football player, sitting next to me. And this Firewalk thing, it starts like 5 hours before you actually do it, like the psych up for it. It's like, it's just stupid. It's like, okay, we're going to visualize, we're going to mentally. And so I'm like going along with it, and I'm mentally visualizing, and then you got to get all fired up, and then you're jumping up and down, and sit back down, lay down, and visualize. And I'm getting to the point where I'm telling the guy next to me, you know what, this is stupid as fuck. I'm going to leave. He's like, you can't leave now, man. Everybody's going to think you're scared of the fire. I'm like, I'm not scared of the fire. I mean, we've been getting fired up for this thing for 3 hours. Yeah. I'm like, I lift fucking heavy shit for a living. I need 15 seconds. One ammonia cap, hit that, fucking let's go. That's all I need. I don't need any of this. And the guy said, he says, Dave, you're missing the point. Most of the people here have probably never played a sport. They've never been fired up to do anything.
Yep.
They've never been excited to do anything.
Yep.
So you're not doing this for you to walk on the fire. You're doing this to be able to help them to be able to walk on the fire.
That's
I thought,
awesome.
Okay, this makes sense. I still don't like it, but I'll do it, and I'll get to it. And then when you get there, it's, the fire walk's stupid. It's nothing. It's just walk through the fire and it's done. And it's a huge celebration for a lot of the people. It's like, yeah. I'm like, okay, let's just go home. But for some people, it's life-changing.
Oh, yeah. And, Tony will be the very first one. He says there's no social or economic value of doing a fire walk. This isn't new picnic skills that you want to be doing. But his whole thing is that, metaphorically, most people don't think that they can walk on fire. And so if you can do that, he's just trying to give someone, as far as just a reference point. You didn't think you could walk on fire, so why don't you think you could open up a business or go back to school or be closer to your kids or anything of that nature? So that's the first thing. And he used to have people jump out of airplanes. Says that's cost prohibitive, so he chose the fire walk. And I've done 30, 40 seminars. We set a world record of the fire walk. It was 40 feet. The one that we did was 12, so it's 4 times longer.
Yeah.
And there's certain people that they just have such good state management. I've seen people that were in a wheelchair, and they flip them upside down, and they walk on their hands. Now, those coals, they are anywhere between 1,200 to 1,500.
Oh, it's for real. If I would have stopped, it would have burnt.
Oh, God, yeah.
There's no doubt about that. It was for
real. I've done it many, many times. The only time that I did get burnt, which is a little messed up, is they came up to Toronto and they said, we need some volunteers. And I said, I'll help you guys. So I actually built the fire. I didn't think the fire was real. I just did it too many times. I took it, it's kind of like not getting psyched up for a max squat. You just get underneath, you're going to crumble. That's the way I did. Halfway through, just barbecued the shit out of my feet because I didn't believe it was real. But the ironic part is I helped build it. So it was real. I know what they did. Like, it wasn't, lights or anything else. It was coals, and these coals are friggin' hot.
Yeah.
So, he's done some great work.
My biggest takeaway though from that, and just from him in general, and his tapes, the old school tapes, were the ones that they didn't get me to start Elite FTS, but they were a part of it.
Yep.
There were other factors and people who helped as well, just as much. But they were a part. They did get me to become a way better personal trainer, by far, and that's because of his 6
human needs,
which that I thought I understood from the tapes, but listening to him speak about those, the 6 human needs, and I think he's rebranded some of them now, but I believe, off the top of my mind, I may forget one, but you'll know, certainty, uncertainty, significant growth, contribution, love.
Yeah.
This is to validate to everybody that this is how important this was to changing, my life, my business, and the way I think, because everybody's motivated by one of those needs, and look at me, look at what I do, and tell me which my prime motivator is. It's very easy to see, it's contribution. But what he didn't explain is what I learned later, just living and running a business, is people's needs can pivot. They can shift, emotions can shift. They still return, I think, to base. This is kind of what I'm going to be asking you about, how you've seen it, because I use it when I'm communicating with people. I try to, what is their driving need? Because if I know that, then I can better speak to them. I can better serve them. I can better treat them as an employee. I can better reward them and so forth. But if there's emotional stress or distress, then it seems to pivot. And if I try to address what that basic need is, it doesn't work because I'm not Tony. I can't dig them back down. You know what I'm saying? It's like they throw up a shield that is there that's hard to get past. So have you seen that?
Yeah, well, the thing with the 6 human needs, you have the 4. So you have the sense of certainty.
Yes.
And then so everything's based on paradox. The paradox of that is the sense of variety. So if something is too certain, you're going to get bored. So you need variety, and we see this in relationships. You have the sense of significance, and the paradox of that is connection and love. He says most people are scared of love. He says so they go for a connection. The more significant that you become, the less connected that you are with people. So those are the 4 human needs.
Yes.
Then you have the 2 spiritual needs, which
Yes.
is the sense of contribution and also the sense of growth. And he says, unless you're growing, you're dying. The bottom line. And the whole thing is, how can you contribute? So you can find what is it that actually people need in that. Look at the paradox. So someone is so significant, but they don't know how to connect. So then you find different strategies on and you got to start from the basis. Or some people are just so connected with everyone and they don't stand out. They're always in the background, but they need to see their own greatness, and they don't know how. So you slowly culture that out. And once they kind of master some of those different aspects, then you can actually slide them into growth and contribution, because they're so messed up here that they don't know how to grow and contribute. You can still do it, but it won't be the driving force. And if they're already doing it, it will be at the expense of themselves, which is what I've done in my business with Swiss, because I do it and everything else, and we've had many conversations from a financial standpoint, and my idea is that I just want to do as best a job as I can, and sometimes it works out okay and sometimes it's a complete friggin' disaster, but I'm still doing it. And I took some time off and everything else, and I thought, no, you know what, this is my calling. If nothing else, I know that the seminar and the symposium is a collection, and talking to all the different presenters, and I'd like to get your viewpoint also, is everyone's like, this is really bizarrely special in the sense of it's collective. Everyone leaves their ego at the door, and it's just so you see stuff that you normally wouldn't at different places.
Yes,
and it's a real melting pot.
It is that. The one thing that you just blasted my brain with is from Team Elite FTS standpoint, staff standpoint, my aim is to live, learn, pass on, which is the 2 top.
Yeah.
Which if the bottom 4 aren't covered, can't get there.
They don't have a sense of certainty.
So how much time, now this is what's going through my mind, how much time am I spending on the bottom 4?
Yeah.
And I'm sitting here thinking, oh, fuck, there's my problem. So that was really helpful. Now I'm like sitting here. I need to go sit down and write some shit. I got this. This is huge. This is paramount. This is huge. From the Swiss standpoint, the thing with Swiss, and I can speak from being like a beginner to speaking in conferences, and I've and this, I've never been one that's done a conference for any monetary value. I really don't want to be paid. I think you can speak to anybody that I've ever spoken for. I want the money to go to charity. That's just me. It's just, I'm not saying it's right. I'm not saying it's wrong. It's just me. I understand people make their living doing this, and I respect the hell out of that.
Yeah.
I get that. But that's never been a driving force. The driving force was to be able to help people. And with the first one, there was an intimidation factor, even though my ego was way higher then than it is now. But you're still, I'm around people that I was reading their books, to increase my own education. So, and I already knew Eric, so I'm like, Eric's way smarter than I am. And then I'm selling Ian's books, so I'm reading his books, and then Charles, his stuff and the content that he was putting out and all this other stuff. I'm like, I know how to squat, man. I know how to bench. So I was comfortable, but I was like a new kid in a territory of, people who knew way more than I did, but never felt that. Even at dinners and everything.
Yep.
I never felt that. Never felt your meathead, and typical
No.
things that I would feel in other conferences or other gatherings and so forth. It was just never there. And I think that's because you have the bodybuilders and all that. And so that was always something I looked forward to. The networking for me is a huge thing because I get to meet people who know more than I do, that I always walk away learning things. And then the people who attend are also very serious about what they're doing. There's very few people that are in there just because they train and they love training. So you're speaking with people in the hallways that you're actually learning from them, and I love, I probably spend more time in the hallways than anybody combined, during those events because I love that because I'm learning. And not only that, but you're learning about your potential customers and all the other kind of stuff. And that was always there. And then you kind of hit me with a whack upside the head the one year and awarded me a
Lifetime Achievement
Award, which I didn't get, and I asked you about it afterwards, and you explained, the things that you do, how you do it, and it touched me. It helped to validate, the path that I was going, because I'm taking a different path. I'm taking my number one asset and giving it away and selling other stuff to be able to help give away my number one asset, which is a different path, and it's all, I still question it today. But the conversation we had after that, where I'm like, well, I don't understand why I'm sitting here with like Paul Check on one side. I don't get this. Why am I here? Why me? I didn't expect this. And that it wasn't an ego thing at all. It was just a why thing. And then it validated from that standpoint. Now I can fast forward then and say that at the last one, well, the one before last, the last one, unfortunately, I had to miss. The one before last, I was at dinner in the corner with Bill Kazmaier, Donnie Thompson, and Dorian Yates. And then I'm sitting right there and I'm thinking to myself, this is fucking awesome. Yeah. This is an opportunity for me to try to dig into their brains, because I got a powerlifter that was the greatest of all time, that broke records that all-time world records, and I know Donnie personally, but still, I want to speak to all three of these at the same time. I want to find the commonalities. And then Dorian, and then Bill. And the weird thing is their personalities they're so vastly different that to try to find commonalities, it's impossible. Because they're just not. And Dorian, I respected the hell out of him for being able to actually step out and change his identity.
That was amazing.
I still struggle with that. That was the hardest thing from going from not being a powerlifter anymore. He has no problem with, now he did tell me he had a time, he had
5 years of depression.
He had 5 years of depression dealing with that, and Bill, we did talk about that. That's one of the things that was a commonality, that this is for real. This isn't shit that just happens with football players or basketball players. It may even hit a little harder, because in strength sports, nobody tells you you're done. You have to tell yourself, or the sport has to get you by injury. You're just done, and you don't want to be. But then once you get further away, then you realize, okay, that time served that purpose. Which now this is a different chapter, but what is it? And
you got to reinvent yourself.
You got to try to figure it out. So, in essence, the core of what Swiss is, from the presenter standpoint, hasn't changed. It's still,
And it finally hit me. I always said that the symposium is in the hallway, and when I said that, I actually didn't know what the hell I was saying, and I didn't know how to explain it. And this year, in 2018, it finally hit me. In the ballrooms, it's a one-way conversation. So it's from the stage to the audience, maybe the odd question, but it's usually just one way. In the hallway, like what impressed me the most was you in 2016. You grabbed a chair. It was on a Saturday. You put it right in someone's booth, and you just sat there all day. Even though you wanted to go and see all, JL was presenting, and all these, Ian was presenting, and all these people were presenting. You were like, no, I just want to sit here and talk to people. I had a 45-minute conversation with you, which really changed my business, because you went, are you doing this? Are you doing this? Are you doing this? And I went, oh, no. And then we had the conversation back and forth, and you went, okay, these are some of the different ideas. And I went, this is the symposium. That made it for me, for the symposium. That 45-minute conversation, it was like, shit,
Well, see, what I think, some of the presenters miss, I mean, you're still going to always get, because you got a lot of presenters, and they can be a pain in the ass. So we could go on for an hour just about that, but we'll leave that. We'll leave that alone. But what I think some of them miss is this is being videoed.
Yeah.
All right. I have the videos. I've seen almost every one of them. I don't have to go see it live.
No.
If it's a team member or somebody that's working on their presentation skills, I'll drop in just to be able to give feedback, say this is good, this isn't good, and so forth. But you lose the opportunity to be able to, because once somebody comes out and you present, and so thank you, there's that, there's validation that you're actually doing something in the industry, which is nice. It's gratifying to be able to hear that, especially when you do most of your work online, because you're not getting that face to face. But once you get past that and you have time to be able to get past that and start finding out who the individual is and what they do, the stories are amazing. The background of some of these people, they should be on the stage. And it's like, oh shit, now I can ask this person, and then it turns into a 20-minute conversation where they're teaching me, and it's just,
it's unreal.
That's where it is. It's just, people have to be forthcoming. They have to be willing to ask. And if for some reason they do run into a presenter that is a dick, just forget about it and realize they're 99% of them are not.
Yeah.
They're
the
just
odd one.
Yeah. Or you'll get somebody that's got to get back to the room because they got to do something quick, and they're just just blowing by.
But everyone was so friendly.
Yeah.
That was the big thing that I noticed, is that everyone's just getting along. And I remember there was you and Stu McGill and Donnie Thompson, and three of you having a great conversation. And then I see all these other people, and they kind of inch in, and they're just attendees, and it's like, you guys are having a conversation at such a high level, and they're like, wow, we get to get this, which is different than listening, getting your information from online.
Oh, it's totally different.
You miss that personality. You miss that experience, and that's always, that's the thing that I always say. Why should you go to the symposium? The biggest thing is, what? I'm going to be doing it again in October 2020, and I'm just met with the hotel this week. So it's going to be unreal. It's, we'll chat about it. But the whole thing is that it's just a collective of like-minded people. Again, I'm going back to Seth Godin. The whole thing is the tribe, the idea. Let's raise the standard. Because unfortunately, I think the standard has dropped a bit, just because the whole social media it's well-intentioned bad advice. People are just making shit up for the sake of it.
It's harder to vet people too, as far as the new speakers. But what you have now with Swiss is you have enough of the veterans that are setting the example.
Yeah.
So when a new one comes in, if they're going to be good, they're going to see, hey, everybody's sitting and talking and staying. So this is what you do.
And and it's not about you, and you can't be a real chucklehead in the sense of thinking that if you're going to walk around and think you're 400-pound bench and then you run into Kaz, give me a break. You just, that doesn't work. And if you think you're really smart and you have a really humbling conversation with Stu McGill,
exactly.
It's just and everyone does it eloquently, and it's not from a standpoint of no one puts anyone down. It's just that's who they are, and they'll sit and listen, and they're like, okay, and then you kind of get the idea, like, I guess I need to do some work.
Yeah. Okay. Well, I want to thank you for your time and wrap this up, and that's it.
Great. Thank you.